you'll have to wait in line. And I have some experience in Britain because I was in the service over there, and our son got sick. We took him to a British hospital because we were living off base. And there was a room full of people the size of this crowd. I walked in and they said, "Are you paying?" I said, "Yes, come right in." I saw the doctor just like that. And you know, one of the things they're saying is if we do this, you're not going to be able to see your doctor without waiting in line. Well, I know for a fact under Dr. Crow's system over there, I tested him because they told me, "Oh, we'll take you right away if you just call." So I had my wife call at 8 o'clock in the morning. Guess what? He saw her at 10. That's how good that system is. That's free enterprise.
I want to agree with what Sam said, but I want to put a caveat on it. What he said, as far as it goes, I agree with. But in the last 50 years, we have made a decision as a society that if you're over 65 and need health care, you're going to get it through Medicare. My mother is alive today because she was able to go to a specialist in Houston and have a brand new sleeve put on her main aortic artery, I think, going into her heart. That cost about $80,000, which she didn't have. But because of Medicare, she got that treatment, and I had lunch with her today. We have also made a decision as a just society that if you're poor in America, if you're unemployed in America, and you need health care, we're going to give it to you. Now, we try to have an opportunity society that Sam talked about, and that we all support up here, that most of the time, most of us can take care of ourselves and provide health insurance through ourselves or our employer so that we don't need the government to step in and help us. But for those that can't help themselves, we have decided through the Congress and through both political parties that we're going to provide health care. Now, a Democratic congressman from New York City in the Energy and Commerce Committee trying to show off offered an amendment to repeal Medicare, saying, "Okay, guys, on our side, put up or shut up." Nobody voted for that amendment, including him, on either side of the aisle. So, we may want to go back on that, but I don't think many members of Congress are going to vote to repeal Medicare. I don't think many members of Congress are going to vote to repeal Medicaid. Many members of Congress, especially on the Republican side, will vote to reform those programs so that they're here 30, 40, 50 years from now and they don't go bankrupt.
Let me make another comment. Right now, when you're 65, you are forced to go on Medicare by law. It's my view that some people don't need to. And i.e. the Ross Perot's of the world. In fact, Ross asked me about it. So I filed a bill to allow people to opt out of Medicare if they want to. And do you know that if just 3% of the people opt out of Medicare, we will save close to $2 billion a year. And that's failed again in our committee because of one person, Pete Stark, on the health care system.
One more philosophical question. Do people have an obligation to take care of themselves? And if they don't, is it appropriate for employers and insurers to charge lower premiums for people who do and higher premiums for people who don't? It seems to be, over on the Democratic side, a real hostility to any financial encouragement of healthy behavior. Do you all agree with that, or you disagree?
Do we disagree that that's what the Democrats are doing? No, we don't disagree. If I could just, I guess, add to the previous discussion, I think clearly there is a role for the federal government to to preserve a social safety net for those who are too old, too young, too disabled, temporarily out of luck with respect to health care. But the question is, how do we best get there? Number one, you have to have wealth creation in our society, which a $9 trillion debt is not created. In a competitive market, and again, I think most of us would admit it doesn't exist today, because if you're not on Medicare, by and large, your employer, a third party, chooses your health care for you. You can buy auto insurance from the green gecko with the British accent, who is headquartered apparently in Virginia, but you can't buy a health care policy across the state lines in Texarkana, Arkansas. So I don't think any of us are here to defend the status quo, because the market hasn't been allowed to work. But if the market is allowed to work, then yes, individual responsibility has to be a part of the program. And let me tell you, as a member of Congress, and I realize I have less tenure, less seniority than my colleagues, but I think you would find in congressional debate the three least uttered phrases are constitutionality, personal freedom, individual responsibility.
Eddie McBride, the questioner wants to follow up and just make sure they heard you correctly. Were you saying that in your plan you take everyone regardless of pre-existing conditions?
That is correct.
And so is that a private sector free market solution without federal mandates?
That is correct, and without any tax support, may I add.
And do you feel like this is a model that can be followed elsewhere?
Absolutely. You're going to have your regional and your market considerations that you have to take directly into consideration, but there's absolutely no doubt that given less government interference, given less bureaucratic involvement, the private sector option will work and allow the opportunity for small businesses to again grow based on that model.
Every analysis I've seen from the Congressional Budget Office to all the private groups, they all say that these bills before Congress are not going to control costs, that spending will be higher if you pass these bills. A, do you agree with that? And B, is there a Republican approach that would control health care spending?
Well, I'd like to say that we've covered that, but yes, there will be, is and will be that opportunity. And the key part there is that I think Congressman Johnson said it, getting those scored by the CBO is a real problem, because the Democrats kept doing, redoing, overdoing their bills, and ours have not been scored. But ours are market-based and would make sure we answer the question, that is, can more people have health care at a better cost, control what they're doing, and the outcomes be better? And keep the government out of it where we don't go bankrupt as a nation. And the answer is yes.
The bills that Jeff has referred to, the amendments that Sam and I offered in committee, we think would cost about a third of what the President's proposal is expected to cost. On the scoring issue, the only thing the CBO will score is an official chairman's mark of the committees as they're presented. If the President presents a proposal, the President's proposal is not going to be scored by CBO unless it is endorsed by the Speaker and the Chairman of the Ways and Means Committee and the Chairman of the Energy and Commerce Committee. And it may be scored by Office of Management and Budget, which is the President's scoring arm, but it's a very technical term, but